My name is Michelle Spray with Optometry Times, and we're talking about electronic health records today.
And I'm Alistair Jackson from Eye Care Advice, and we're going to talk a little bit about the article EHRs and the new healthcare game.
Okay, why are EHRs important?
Well, EHRs are important really because they are the gateway into the new healthcare game. It's like if you don't go through that gate, then you can't play the game. So if you look at what we're doing in America, it's really all about replacing paper records with electronic records. And so EHRs are the core of certified EHR technology.
Okay. Can you outline your five-step continuum that you have in your article?
Yes, I certainly can. So this is a five-step continuum for eye care providers. And so step one of the continuum is really to get and implement and use electronic health records. And a couple of points of clarification is it's really certified EHRs. It's not any EHRs. It must be certified EHRs because it's that technology and the standards that are being driven by certification that's so important to the future of healthcare. The other thing I'll say is that this game we're talking about, it's really a survival game. And so if you don't go through that gate of EHRs, you will not survive in the game. The future of being in the healthcare business relies on the use of certified EHR technology. So it starts with implementing and using EHRs. Step two of the process is really now about communicating. So let's just use that to back up a little bit and look at stage one of certification, which is really all about EHRs. So using them, learning to record patient data in an electronic record versus a paper record. So once we've done that and we've now got patient health data in an electronic record, what do we do with it? Is it really there just so that people can read our handwriting? No, it's there because we need to share that information. The healthcare reform model is a coordinated care, a connected care model in which we are sharing health information because we can. That's what the technology is for. So sharing health information is really the crux that we'll find in stage two. The focus is not so much on just now you've got records, health records. It's now let's share what's in those health records. A couple of comments on that is that when we look at sharing, the obvious mechanism that we hear a lot about is health information exchanges. I believe as independent eye care providers, health information exchanges are important, but there's something that's more important first, and that is the direct messaging protocol. So the Office of the National Coordinator created this protocol called Direct for the nationwide exchange of health information. It's ideally suited to provider-to-provider exchange and provider-to-patient exchange. And so since independent eye care providers are not employed or necessarily deeply involved with health systems, then I believe health information exchanges become the secondary place, and I think we can get distracted by worrying too much at first about health information exchanges. It's the direct protocol that is actually mandated in stage 2 certification that is such a useful tool for independent eye care providers for sharing their information. And they can be sharing with ophthalmology referral centers, and they can also be sharing with primary care physicians. So that really brings us to step 3 of the process, which is to position your practice for the team delivery of care. And so again, we're moving to team-based care, which is coordinated, which is connected, and we're using the certified EHR technology to do that exchanging. So what do we mean by positioning for that? Well, it means getting ready internally in our businesses, because sharing that information really means a paradigm shift. It means that we're moving away from our physician-centered mindset, our physician-centered workflows, and we're moving to a patient-centered model. And we need to think about communicating with patients and communicating with other providers on the teams of which we want to be a part. So positioning means change the culture of the practice, and as I've mentioned in the article, the American Academy of Family Physicians has done a particularly good job of preparing this roadway for PCPs, and that's happening through TransformEd, and certainly encourage you to have a look at what that means. If primary care physicians are making that switch, then eye care providers need to be doing the same thing. So the fourth step in our continuum is really getting acceptance on those care teams. So understanding that as part of this evolution, we're seeing there are significant pilot projects. We certainly all heard about accountable care organizations and health information exchanges, and this concept called the patient-centered medical home. It started in the accountable care organizations, but then there was a move to put that same model into primary care practices, and this is the one that I believe is particularly relevant for independent eye care providers. So they become responsible, the PCP, whether we call it that, the physician or the practice, is coordinating the complete care of a patient. And then the question becomes, does that coordination involve me? Because certainly it involves my patients. And then the question is, if they're going to choose an eye care provider for the care team, who's that going to be? Is it going to be you? Or is it going to be the employed optometrist at the local hospital? And by default, I believe it'll be the employed OD, and independent eye care providers need to take action, need to use the certified EHR technology, need to get familiar with that direct protocol, and start to build relationships with local primary care physicians and say, hey, look, I want to be part of the team. What does it take? I have the technology. I'm ready to use it. I'm ready to share records with you. And as an independent eye care provider, here are the strengths that I bring to the care team. And then we talk about your knowledge of disease conditions and what you can bring to the table. Look at the #1 priority in healthcare right now. It's obesity and diabetes. So what optometrist doesn't know a lot about the preventive care of diabetes? And so as we're bringing our knowledge of diabetic retinopathy to the care team, that's significant, and we need to be prepared to show that this is what I bring to the table, and I'm ready to use the technology to deliver that into the care team. So that's what it means to get acceptance and to show value for care teams. So the last step in the process is really about access to patients and to payment. So again, we need to understand that we can potentially lose patients if their care is being coordinated and we're not part of the team that's coordinating the care. So we need to take action to protect our access to our own patients and recognize they can be stolen away by coordinated care if we're not ready to play the game. And that's why it's a survival game, because if we lose access to our patients, then it's only a question of time as to when the survivability of our business is called into question as well. So that's a nutshell on the 5-step continuum.
Okay, great. After physicians implement EHRs and these 5 steps you've outlined, what comes next? What's the next step for them?
Well, I think really the next step is to continue to move through this whole certification process. And again, certification is significant with or without the money, the stimulus money. So it's not about grants, it's about following in all circumstances what's happening in certification. I believe that optometry needs to be involved in establishing those best practice protocols. The danger is that ophthalmology is going to get to dictate all those protocols, because as an organization they're further ahead with the evidence base of medicine. And so optometry needs to step up, look at the preventive side of eye care, because we know that preventive care is cheaper than acute care, and optometry has an important role to play in the prevention, for example, of diabetes. And so how do we step up and participate in that game, and then participate as individuals in driving those best practice protocols? So those are some of the developments that will come. I think the bottom line is that technology will continue to revolutionize healthcare and eye care, and we need to be in that game with the technology, moving ahead, embracing change. We know that when it comes to survival, that adaptation is the key. Adapt to survive.